When we think about how we used to do dentistry and the time before digital dentistry, it's actually kind of horrifying. One of the single most important skills in medical aesthetics, to be able to look at a patient's face and see geometry and see angles and see proportions and figure out where they're deficient and figure out where it needs modification. I have to always correct people when they say, oh, well, you sold out on dentistry, you're doing aesthetics now. I don't think people realize how challenging medical aesthetics is. 100% of your patients are very demanding. There is no one that's in medical aesthetics because they're looking for the easy thing to do in medicine. As a medical provider, when you meet a patient for the first time, they're walking in the door with an expectation of what they think you're going to be, and you have all of 10 seconds to dispel that.
Hello everyone, Paul Fulford here, and welcome back to the podcast. Today we're continuing our theme of peak performance and wellness with a trailblazer in their own right in digital dentistry and medical aesthetics, Dr. Gregg Martin, who's based out of the DC metro area. As you'll hear and learn, he practices there, and he's there practicing on a regular basis, but he also lives in Florida. He is really pushing the envelope as it relates to industry norms. Right, he's introduced cutting-edge technology as it relates to digital dentistry as well as medical aesthetics, and we're going to dive into topics of how these things blend. He started his journey from a high school math teacher to a dentist to now introducing medical aesthetics, and he's also a certified fitness instructor, a man of many talents. So without further ado, let's dive right into the podcast. So Dr. Martin, digital dentistry has been a hot topic as of recently, especially with advancements in AI and 3D printing. What excites you most about the innovations and the advancements, and where do you see the future of this going?
When we think about how we used to do dentistry and the time before digital dentistry, it's actually kind of horrifying. If you remember these big goopy impressions where they're putting all this stuff in your mouth, that's all the pre-digital phase. And so today everything is done by AI and by computer, and it just allows us to deliver stuff that's so much more predictable the first time around. It's really exciting, and I'm actually grateful that the bulk of my career so far has been during the digital age, because I actually have a lot of sympathy for the dentists that had to be in those messy offices where everything was analog.
With digital dentistry, right, there's tools, right? And you can explain, I guess, with some of these tools a little bit more depth. I think in the past, people weren't able to kind of see what the results would be. And do you feel like those enhancements allow for a patient to truly understand what post-procedurally that would look like? Are you able to show that to patients?
Oh, for sure. So today when we're doing anything cosmetic, and of course the first thing that people think about with cosmetic dentistry is veneers. Mm-hmm. That's everyone's veneers. Mm-hmm. Doing veneers for a patient is a lot like renovating a house. You're never going to demo a house when you don't have a blueprint for what it's going to look like. Right. And so what we do today is we take pictures of the mouth, and then we actually mock it up digitally, and we actually design the teeth with the patient. And there's a lot of different considerations that go into what a tooth should look like. The shape of your teeth speak for your personality. People that tend to have harsher, like corners on their edges on their teeth, that could be as a result of grinding their teeth all the time, and then that actually portrays this perception of this is a very intense person because they're grinding all the time, and this is why their teeth are edged like that. Yeah. And so when we actually go and we develop veneers for a patient, we want to capture their personality. We actually say, what is the message you want to put across to your friends and family when they see your new smile that we're
So the shape of veneers can help portray that personality for somebody?
100%.
How so?
Some teeth are more masculine, some teeth are more feminine. That's not just cultural, that's also anatomical. Women actually do have slightly different shapes in their teeth. Mm-hmm. And the fascinating thing about dentistry and facial aesthetics is that our brains, we've seen so many people and so many faces over the course of our life that we're constantly taking measurements and calculations of people's face that we're not even aware of. So subconsciously, yeah, exactly. So when you look at someone, you are sizing up so many things about who they are that you don't even, your brain's running all these calculations that you don't even know are running.
Right.
And so when you go to a really good dentist or doctor who has a good feel for, how your brain processes someone's appearance, you actually can bring this up with the patient ahead of time and say, what do you want to be putting out as your persona, and we were going to build that into your smile.
So again, parallels to where medical aesthetics, cosmetic dentistry, there's that ability to become or fix what was once something that bothers you. Right?
Oh, 100%.
You didn't start out with medical aesthetics, but I mean, you definitely hit the ground running with medical aesthetics, a thought leader in just a short period of time, right? With those two different pieces, like what excites you about now being able to offer and provide cutting edge medical aesthetic treatments, and what has that parallel meant to your practice?
Well, it is still relatively new that dentists are getting into this space. So I'm sure 20 years in the future, it's not going to be anything exciting that a dentist is doing this kind of work. Right now, it really is an opportunity for me to set myself and my practice apart. But I can't drive home this message enough that your smile is only half of the story, and your skin's also only half of the story. The two really have to be together. So there's this famous graphic where you look at this person's face and you say, what's wrong? And the guy's missing a front tooth. Right. And everyone says he's missing a front tooth, but you don't notice that he's missing an eyebrow. Right. Until someone points it out. Right?
You don't at all.
Exactly, because we go so quickly to the teeth. So if you're in a medical aesthetics practice, in my opinion, of course I'm biased because I'm a dentist, but in my opinion, if you're only doing, if you're only doing skin, you're missing out on the teeth. And then for my dental colleagues, if you're doing teeth and you're ignoring their face, then you're also missing half of the story. Now, that doesn't mean that a person couldn't go to two different providers and address both of their concerns, but dentistry is really a primary care field, and so patients have a relationship with their dentist and a sense of trust.
That's definitely a sense of trust, yes.
Yeah.
So you feel like that sense of trust and that relationship you have with them, it makes them more receptive to talking to you about other things that bother them?
Oh, sure. Yeah. Of course. Because if you think about your own doctors, if you have a good doctor, which I'm sure you do, you should be right. Well, luckily in this field, we all know a lot of good doctors. And we know really quickly what sets the good doctors apart. It's this empathy and this sense of connection with someone where they really do care about you, but they also make you feel comfortable. Right. So, I can't tell you how many times I do a new patient exam, a dental patient, and the patient says to me, "Oh, my last dentist yelled at me for not flossing or for whatever." And I guess the equivalent in primary care is like, your doctor is yelling at you for your cholesterol being too high or your blood pressure being too high. Right. And we hear these stories all the time. And I just don't understand how a doctor can be, I know that it happens because so many people say it to me. Yeah. They can't all be making it up. Right. But we want our patients to be healthy, but this like old school, type of mentality of like, oh my, you didn't floss, it's like, scolding like a kindergartner. That's never going to build a trust with a patient. In fact, what's going to happen? What do you think happens when you scold patients?
They're going to be less responsive.
Exactly.
To wanting to do what.
Not only that, but they stop telling you the truth. Right. They just start withholding information.
Like children.
Right. It's like, yeah, I floss every day. Yeah. I'm like, right. But if you're actually open to them, then then they will start sharing more, and then you can actually help them, and you can help them understand that I'm here to provide information and to meet you where you're at and make you healthier. It's not to meet you where you're at and belittle you for it. It's just I want to help you improve. I want you to get better, and that translates into medical aesthetics also, because if you can't get a patient to say to you that, if you can't get a patient to admit or confess that they don't floss, how are you going to get them to also talk about what actually bothers them on their face if it's something they're very sensitive and embarrassed about?
We've sat on panels together, and I know that many times we discuss like what's the difference between an average doctor and a great doctor. And to me, it's always been, it's not a secret sauce or a science. It's the doctors that are great, they give a shit. Yeah. Right. I mean, it's without being overly blunt about it, but to the point, right? It's looking past the aesthetic,
right?
Pun intended, right? Where it's asking the additional questions, getting to the root cause of things, right?
Yeah.
So for you, right, how do you stay ahead of the curve, right? We're actually shooting remote on site at the Beverly Wilshire at a workshop that we're both going to be presenting and speaking to peers at this weekend, right?
Right.
How do you stay ahead of the curve, and how did you stay ahead of the curve before you got into medical aesthetics?
Well, so two answers for that. One of them, I kind of let my patients guide me. You listen to your patients, and like, hey, what are you hearing? What are people doing these days? Like, what gets you excited? And they will tell you. I also have a little bit of an unfair advantage that I met these workshops with you and a lot of amazing doctors, and I'm literally hearing in first person what's going on, and even though I'm a presenter at a lot of these workshops, every single time I leave one, I have a new idea. I'm like, oh my God, I want to be doing this. I want to bring this to my patients.
Yeah.
My first divergence off of just like driving down a straight path of dentistry and going a little bit off of my lane was injectables for me.
The gateway drug, right?
It is.
Basically,
It
right?
is.
Yeah.
It's also the most consumed
Right.
aesthetic procedure in the world. I have a lot of patients that were always asking me, "Oh, you're a doctor. Can you do my Botox?" And I was actually really lucky because my dental school really did advocate for dentists doing Botox.
Good.
That's a whole other story because there are some schools that are very much like, no, we don't want to do this.
You're in the face all day, right? To me, it's a logical progression. Because and then you've got facial oculoplastics. Like again, that's another side thing with that is face oriented. It's natural for them to get into it too. But dentistry, it's always been something that I was surprised it hadn't been. And my dentist at home, they have the husband is the dentist and the wife runs the whole medical spa, and they have an institute. It's huge, right? They also utilize Cynosure electronic products. You've brought in a lot of different devices, right? A lot of Cynosure electronic devices that just by happenstance, it's not like that's the only equipment in your office, right? But you pretty much have all of the devices with the exception, I think, of one, really, one or two.
Right, the brand new ones, but I'm
yes,
sure they're not
right.
that far off in my future.
So what is it that you see as a trend with, like, again, listening to your patients, that's the most easy to talk to people about, right? On a regular basis.
Well, so as far as the aesthetics and the devices that you're talking about.
Let's say this patient is like a dental patient and they're not an aesthetic patient, right? Like what is normally that conversation look like, and what's the progression?
So I'm going to back up a couple steps here. Okay. I went into dentistry originally wanting to disrupt the system. I feel like most people don't like going to the dentist or don't like their dentist, or maybe both. And I wanted to really dissect why. I mean, why are we taught? It's like we're taught at a very, very, very young age to not like math and to not like the dentist. And most people have
things that you're very good at.
I'm a bit of a social outcast in that sense.
Yeah.
Even if I can't figure out why we don't like the dentist, how can we change it? And how can we recast it so that people get excited about it? And one of the ways that I think I'm really effective of practicing is I always like to teach through analogies. Everything that I do is always an analogy. And so I have so many analogies that I share with my patients, and I'll go through a couple of them with you. But as far as just like medical aesthetics, I always compare a home renovation to my job as a dentist. And when a patient comes in, one of the first questions I always ask is, why are you here today? Who was your last dentist, and why are you not there anymore? Sometimes it's because the guy retired, the girl retired, but sometimes it's, well, they were really pushy, or I didn't think they were. But so
that's a great insight.
Yeah.
Right, because it's like, well, I want to make sure I'm not that too. Right?
One of the critiques or criticisms that I get a lot is, oh well, they said I need all of this work done. Like I need, I've never had a cavity in my life. Then I go to this new person and suddenly I need like 15 crowns, and the sky is falling, and they gave me this treatment. Doctor spent 30 seconds with me, walked out of the room, and then some other person came in, gave me a treatment plan of $30,000. I'm like, well, yeah, if you do that to a patient, it's going to get someone upset in any business, not just dentistry. But what I tell my patients is when I see you for the first time as a dental patient, I am going to do what's called a comprehensive exam. That's where I'm going to literally look through every single piece of every angle, every corner of every tooth, and I'm going to write down every single problem that I see. Now, the analogy is like if you have ever bought a home, one of the very last things that you do before you go to closing is you have the home inspection, and that's where you walk through the house with a person who's writing everything down, or I guess
like a punch list.
Yeah, exactly. Because it's their responsibility to tell you before you actually go through this transaction that, the roof is a little bit leaky here, that window has a little bit of wood rot in it, the washer is probably going to break in a year. Like, you have the right to know everything. It doesn't mean you have to fix anything.
Right. And again, so with that, a great analogy, right? How do you present that as options to the patient?
So I say we're going to do the home inspection, and no matter what, you're buying the home because you're taking your mouth home with you today. But I'm going to go through. You have the right. You have you have paid me to tell you everything that I think is a problem, and then not only am I going to do that, but then we're going to prioritize it based on a couple different criteria. Number one is always infection. If there's any infection anywhere in your mouth, I'm going to highly recommend that we address that immediately. So it's called the acute phase of a treatment plan. So if and you might not know that you have an infection. There are.
How does somebody not know they have an infection?
Because if it's chronic, if it's been there for that's a great question. Yeah. If it's been there for a long time, your body might have suppressed it. It might have gone into the tooth might be completely dead. It could be necrotic, and you're no longer noticing it. One of the things that drives all dentists crazy is when a patient comes in and says to us, "Well, why do I need to get a filling? Nothing hurts in my mouth." You know how many times I hear that at work?
Really? That's shocking to me. Because again, like if I've only had one cavity in my life and it hurt before and that's why I went in, right?
Exactly.
So they just dealt.
They're just like all my patients.
Well, no. But I mean, they just don't feel the pain, or how does
most problems with our body, with modern medicine and diagnostics, we can detect problems before they hurt. And that's what we're trying to do. We don't want you to get to the point, and in most conditions with your body, by the time that they are bothering you, you've gone into a whole other department of treatment. Like now it's a lot bigger. And also there's some pretty nasty things that can be going on with our body that don't hurt. For example, stage 2 hypertension, cancer, diabetes. These are all things that it's not like, oh, my cancer hurts today.
It's a compound effect.
Exactly.
Right.
Exactly. So we need to to circle back.
Well, yeah, get back into the
there could be infection present and it's not hurting just because your body is not detecting it. But just like you could have skin cancer which is not hurting, and if a doctor doesn't tell you, hey, this is here, then it can become a lot worse. So we're always looking. So infection is always number one, and then after that, it's always it's a combination of things that I think are going to become a problem, presenting expectations of what's going to happen if you don't address it. Another big thing we hear all the time is, I don't want to get my wisdom teeth taken out because they're not hurting.
Right.
And that's where I would say, well, 80% of Americans eventually need to have them taken out at some point in their life. I understand that they're not hurting right now, but the last 200,000 people behind you that looked just like you ended up needing to get them taken out, and that's why we do practice a little bit of this is the math part of it. We do a little bit of medicine practices based on statistics.
Like firsthand experience, right? I had space for my wisdom teeth to come in.
Yeah.
They came in and nothing was impacted, and I had them for a few years into my 20s, and I eventually got all 4 removed because just from chewing and eating.
How old were you when you had them taken out?
26.
Okay, so that's pretty, that's pretty normal.
But I never thought I was going to have to, and it was just because from eating, I got like kind of callousing built up in the back, and it started to get uncomfortable, right?
But I'm glad you got them out, because imagine that the one day. I know you're only 28 now, but
right.
But one day when you're 60, right. The 60-year-old Paul would want to go back in time and yell at the 26-year-old Paul for not dealing with it, because you've just kicked the problem down the road. And surgeries, our body's ability to recover is diminished as we get older.
Well, what we do now, 60 is the new 40, right?
Right.
So, right. Anyways, but no, your point is taken, right? So you've brought up the math side a couple of times, right? Went from a high school math teacher, you're to a cosmetic dentist, and you're also a certified personal trainer. You're like
Group fitness instructor.
Yeah,
Group fitness instructor.
Yeah. So, you're a Renaissance man, right? Basically. Where has both the certified group instructor and the mathematics background come into your digital dentistry in your everyday practice now? What are some stories where those things are parallel?
Okay, well, dentistry is extremely mathematical. There's no way around it. In fact, to get into dental school, there is a math section of the dental admissions test. To get into med school, there is not a math section. So whoever is putting these university programs together, the general consensus is that dentists need to be good at math. We're going to test them on it for them to become dentists.
So is math specifically, is it more geometry? What math specifics is it?
Definitely very geospatial reasoning.
Okay.
100%.
Okay.
100%. So I feel like I use math all the time in dentistry. When it's like engineering. When you're building a bridge, there's a lot of engineering that goes into it, as far as like how much force can you put on a tooth? Can I put a fulcrum on this? Can I torque this tooth with this dental device without it causing the tooth to fail? So So
you're looking at force equations and things like that, technically.
I mean, we're not actually sitting down and calculating, but 100%. It's the same. Yeah. And in fact, I love when my patients are engineers, because I don't have to explain as much stuff. Because if they say, can you do this? And I say, no, could you do this like on a road? Or like if you're building a bridge, and they'd be like, no. I'm like, it's the same. It's the same. The fitness was more just a practice building strategy, because I put myself through dental school teaching group fitness at night. And so I already had a lot of trust from the people that have been taking my body pump class. I'm a certified Les Mills body pump instructor, and I've been teaching that format for 14 years now. And so a lot of...
still do, right?
I do. I just taught one 2 days ago, and it's a lot harder than when I was doing it 14 years ago.
Where has that personal fitness side come into your daily practice with medical aesthetics or dentistry?
Well, first of all, just to do the job, any job is better when you're in shape. Like being able to, it's a grueling. You're standing on your feet all day. You have to always be thinking about your posture, your core strength. I mean, have you ever seen a dentist after 50 years of practicing?
Yeah.
Yeah, exactly. Exactly. So even doing this talk with you right now, I'm always in the back of my mind, sitting up, shoulders back, right? Because I don't want to go into hunched over dental mode. And there's always times when we throw our posture out the window because we just want to see behind that tooth, and then we get upside down, and then my assistant yells at me.
You put yourself in compromising positions all the time.
Of course, yeah. So I just feel better doing my job when I take care of my body. But I also think it's putting a message across to the patients that, this is my whole mantra with medicine is wellness and, full body wellness. And I think that's where medicine is going as a whole. I think that's where the whole...
I hope that's where it's going.
Yeah.
I feel like, again, there's still so much of this when there should be this.
Right.
And again, it's like you being forward thinking and getting into medical aesthetics.
Right.
Like you said, your patients were going somewhere else for it, right?
Exactly.
Or they were asking, why aren't you doing it?
Well, and I also have the patients that are saying, why are you doing this? Like I get that a lot too.
I think that a lot of people, they don't necessarily realize how advanced medical aesthetics in general has gotten, right? What are some of the stories, again, like obviously aesthetic is part of the name, but like what are some of the stories where you've really truly been able to impact and change someone's life, right? I mean, I would imagine you have probably some good ones about people's teeth, right? Because,
sure.
Where that's like, I mean, I've seen so many before and afters where people cried after one.
Yeah.
Seeing the difference, but for your medical aesthetics, do you have any, like a specific story of somebody that you helped that was very impactful for you?
Well, just focusing on the face, let me go back to my analogy. If you were putting a brand new, beautiful, fancy door on your house that you had spent a lot of money on, just think about how much better the front of your house. I mean, the door's going to look nice, but just think how much better it's going to look if you also paint the house. One of the things that I do in my practice now is when we deliver a big aesthetics case, like a veneer case, we automatically include with the treatment planning that we're going to do a laser resurfacing on the day that we cement it all in.
Oh, nice.
Because again, I don't want to put a door and then have the rest of. My work is going to look better when everything sparkles.
So what's your go-to for resurfacing for that particular bundle?
LasMD Ultra.
Yeah. So they just going to make their skin pop.
Oh my gosh. Yeah.
They love it.
It literally turns the patient into an Instagram filter.
Yeah.
Like, we're living in a day of Instagram filters, and I have had patients say to me, I don't have to use a filter when I post my pictures anymore.
And I think that's one of the things, having a conversation with another person that we've worked with, Dr. Kate Holcomb, who's a dermatologist in New Orleans. One of the things that she talks about with her Ultra is that she finds that a lot of the younger generation, especially like the prejuvenation or the pre-revitalization patient, right? They're coming in saying that they need X amount of units of Botox. And what she's doing is saying, well, what are you looking for? Because you don't have a wrinkle. Right. And I respect preventative measures. Are you looking for your skin to pop? And she finds that she's actually able to talk them into doing Ultra, and they're spending less money, but they're staying with her because there's that credibility piece. And it's because they don't specifically know what they're looking for. There's this influencer told them to do something, and they're like, I want to do it. And they're like, she's like, no, that's not
100%.
Yeah. And I'm glad you touched on that, because that's one of my pet peeves is when patients come in and tell me exactly what they want done with that much like specifics. Like if someone says to me, I want 17 units of Botox, I never treat people the same amount of Botox every time, because they're always at a different stage of how much their face is moving. But the thing with the lasers and with the Ultra is that this is all still so new to medicine that a lot of patients don't know about it. So, none of us don't know what we don't know. Right. And so when a patient comes in, a lot of people, that's all that they, like a 23-year-old who probably doesn't even really need to be getting Botox yet at that age. You can certainly be lasering your face at that age. It's going to make everyone, even if you don't have a lot of sun damage yet, you're still going to look really radiant in a different way after you laser your face at any age. Yeah. But they don't know that. And so, and I've actually done some counseling for med spas that are building, and people are always asking me, should I buy a device? And one thing, and this is really interesting feedback to talk to even this weekend, people are not going to come in and ask. So these med spas have said to me, I don't know if I want to buy a device because no one is coming in and asking for those treatments. And I say it's because they don't know about it.
Well, people are doing them, and like people that they see are doing them, they just don't realize it sometimes, right?
Sure.
How do you bridge that gap?
Right. Well, it's analogies. Right. So it's like I just flew here from Washington to, where are we? Los Angeles. Yeah. Right, yeah. I knew I was in California. I almost said San Francisco. It was a long flight. That's all I know.
Where am I this weekend? Yeah.
But when you come into my office and you want to do something, you want to do medical aesthetics, it's like you're buying a plane ticket from Washington to Los Angeles, and that's all you have to do. Then you're not going to go up into the cockpit and tell me how to fly the plane there. I'm going to drop you off where you wanted to. You tell me where you want to go, and then I'm going to say, all right, in order to do that, well, we're going to take off and fly at 30,000 feet, and we're going to have to go around this storm. That's medical aesthetics. That gives patients confidence in their provider. When a patient is dictating to the provider what they want to have done, they might not realize it, but they're not going to be as confident as when they just say, this is what bothers me with my face, and then I say, well, we need to do maybe a little bit of neurotoxin, also laser, and let's talk about radiofrequency microneedling here. And then they're like, oh my gosh, this person's really knowledgeable. I feel safe.
And that goes right back to your bedside manner piece, right? People come in being an expert because they have a phone.
Right.
And they looked up.
They went to Dr. Google.
Right. They went to Dr. Google. And how you manage that, right? To your point earlier, where the ones that didn't like their previous dentist and everything else, like part of what helps somebody be successful is having a demeanor like you have, and having that empathy and that willingness to listen and ask questions, not dictate, right?
Right.
It's like listening and hearing, actively listening to that person.
Right.
So often people get up on their soapbox and like, you should be flossing, like you said earlier, right?
Well, you should, but
Well, I mean, but like,
Yes.
I'm mad at you because you're not
Right,
flossing,
yeah.
right? They're
Yeah.
mad at them. Like, you
right,
definitely
exactly.
should be. But again, and that's that piece that you can talk to about people, but again, I think it's some people have it more naturally than others, and
Yeah.
that's who patients should be seeking out, right?
Well, and this comes from my background as a teacher, and so and I taught math, which is notoriously hard to communicate.
Right.
So my first job and my first professional experience out of college was teaching high school trigonometry, pre-calculus, and calculus to juniors and seniors. So I learned really early on, in order for my students to pass exams, to be able to demystify stuff and present it in a way that they can understand it. Because
Were you using analogies then too?
maybe I don't probably.
Right, yeah.
I don't feel like I have any new tricks. Probably. My mom always says that everyone at some point in their life should be a teacher and should be a server.
I agree with that.
And I actually have never been a server, but I have been a teacher. My mom has been both, and it really does teach you how to to interact.
Mm-hmm. My one of the things my father always said was that he always felt like early on, it's good for like a rite of passage to do a really hard manual labor job as a kid growing up, so that you can say, I would rather use my brain than my brawn and try to work smarter, not harder. Right. And I think sometimes, again, I have a daughter, right, that I'm trying to raise in this modern world. And there's so many, we talked earlier about AI advancements and things with digital dentistry, right? As much as things advance, sometimes we get lazier, right? And there's less things that, people take things for granted. And there's a discipline that goes into all of those things, right?
Yeah.
So you place a huge emphasis on patient education, right? So how do you, and you talked about flying the plane, right?
Yeah.
And so how do you know how to go more detailed or simplify it so that a patient can receive it?
Yeah, so because I have being a teacher so ingrained in who I am as a person, I can never shake it. I was a math teacher, I was a group fitness instructor, where you're teaching form, and I just love teaching, and so I actually kind of make the joke with my patients that coming to any day in my office with me as a dental patient is almost like going to 1 or 2 hours of dental school, because one of the easiest ways to have a patient accept the treatment that you're proposing to them is to just make sure they understand it. And so, when I tell a patient that you're going to need a root canal in this tooth, well, the next thing that I'm going to do is I'm going to say, do you know what a root canal is? Or do you think it's some kind of medieval torture thing that we do to people because we, want to punish you?
I feel like we're sadists.
Exactly. That's another thing. It's like, root canals, everyone is terrified of that term.
Right.
People.
So blood pressure.
So what is a root canal? Let's just go there for a second.
A root canal is just when infection has gotten to the nerve of the tooth, and there's and so the nerve, not to go too far into the weeds, but the nerve is inside of your tooth. It is a self-contained, sterile environment that cannot have any contamination from any bacteria. Okay. If bacteria gets into the nerve, it gets infected. There's no way to remove the infection or to remove the bacteria. All we can do is take out the nerve. And so the analogy that I give to patients is that it only takes 1 drop of food coloring to change an entire glass of water into the color of that food coloring. And once you put that drop of food coloring in, you can no longer take the food coloring out. All you can do is dump the water out and put new water in. That's a root canal. Yeah. We got to take the nerve out, and we can't put a new nerve in, but we just fill the middle of the tooth with rubber.
So once that has happened, once it's been exposed,
it's contaminated. Yeah,
okay.
You let food coloring get into the water. You can't take it out. Right. And so, again, I just educated you on what a root canal is.
Yeah. But in a way that I could receive it
and understand it, because it's very, very, very simple. I tell people all the time, I'm not smart. I'm not that smart. I learned, in fact, I became a math major because I didn't want to write term papers. So To me,
You have
math.
to be good at math to be a math major, though.
Well, they make you good at math when you're going through the degree,
For
but so it's just very, very simple ways to understand, and that's how I educate my patients. I don't expect people to just randomly take my advice if they don't understand it. One of the things that I do all the time, because when I'm doing X-rays, which by the way are also one of the advances in digital dentistry. Everything is digital, so it's no longer the days of developing film and waiting. Taking a dental X-ray is like an iPhone camera. It's like we have it instantly. And if I tell a patient that you need a filling or you need a crown or you need whatever the case is, what I will do is I will put I have monitors in every room for the patients to see. I will put their X-ray up on the monitor, and then I will literally Google image search what I am telling them is wrong with their tooth, and then I'll put what I found on Google right next to theirs, and I'll say, do you see how these two things look the same? Mm-hmm. Do you see this little issue here is what's here? Because then they understand it. So education is really the most important. I think the most important way in any branch of medicine to have people want to complete their treatment.
So you bring up a good point, right? And let's take it from the dentistry now to the medical aesthetics, right?
Yep.
With there being a lot of information out there that people want it, right?
Yep.
And misinformation,
Yep.
right? You just brought up a very good way of showing that with dentistry. How do you address that with medical aesthetics? To make sure that they're well informed to make the right decision in differentiating and sort of filtering out the good info with the bad info.
Well, it's same thing. The Google image search before and afters. Mm-hmm. We ask the patient, what is it you're trying to address? There are multiple things that are going on with your skin on your face that create the perception of aging. Mm-hmm. For example, they've done studies that if you take a picture of a young person and you just use AI to sprinkle freckles all over their face, that's going to make the average American guess their age instantly 12 years older.
Yep, it's 10 to 12 years older.
Right on the spot.
Yep.
And so,
So it's about tone and texture.
Tone and texture.
Right.
So that's like the top layer, that's mm-hmm. the superficial layer. Mm-hmm. Going down deeper, that's the laxity and the volume mm-hmm. and the crepiness. And so, if it's a younger patient, they're probably not talking about their jowls or crepey skin. They're probably talking about texture mm-hmm. Or sometimes pigment. Sometimes people say, I always laugh because I get a lot of, I want to keep my freckles. And then I just remind them, remember, freckles are sun damage. Babies aren't born with freckles. And freckles that you have today are going to be sunspots when you're older, and they're going to be bigger, and you're not going to want them.
That's like anytime you look in our space, right, there is a tool called the Visia that, mm-hmm. And there's other tools that do it. But yep. I was in my 20s tanning salon person, right? I thought, tan skin, you look healthy. I wanted to, and as soon as I saw my first Visia, I was a sunscreen savage, basically, right? Because I was like, wow, all that's underneath.
Well, you and I both live in Florida.
Right.
And it's the Sunshine State, and we never go in the sun.
No. I mean, like, everybody always jokes when I'm coming in from out of town to different places. They're like, you live in Florida?
Right.
And just so that the audience knows, right, like, you practice in D.C., but you live in Florida.
Yep.
And again, this is why we both are point snobs, right? Because we travel so much. But it's true, right? There's and we're in California right now, same thing, where there's very limited time where people are sun exposed, right? So in that same vein, right, it's important for people that are doing that and have a lot of sun exposure, or even people for that matter that are skiers, where you've got the reflection off of the snow that comes up, right? How do you navigate which tool to use in your practice? And what is the benefit of having, some things where there's bleed over, right? Where there's more than one way to skin a cat, for lack of a better expression.
Well, I mean, going back to the Ultra, mm-hmm. which is, that was my, Botox might be the gateway drug for injectables, but to me, LasMD Ultra was absolutely the gateway to energy-based devices. Mm-hmm. And that machine does so many things which help a practice in so many ways that they might not even think about. I treat I really have gotten into treating the décolletage on women now,
And it's such an area that gets neglected after they're dressing their face.
and it gives away age so quickly, so quickly. I just did one last week, and oh my gosh, it must have taken like 20 years off of her appearance. It was insane. One single treatment. I'll show you the before and afters later. Yeah. I mean, it was just stunning, and she also was just so happy. And that's, again, she didn't even know that she should treat that. She was talking about her face, and I said, "Well, you're in here in a V-neck right now, and I can see all this sun damage here. Why don't we get that as well?" And the first thing she said to me is, "You can do something about that?" Like, yes. Yes, I definitely can. And I posted that on my Instagram story. She said, I don't like my neck after I pointed it out. I said, well, I can fix that. And I did. And she was just absolutely blown away. Going back to the Ultra, so one of the little secret weapons of the Ultra is that it actually is really good for treating bruises. It's not maybe the first go-to in the laser arsenal for bruises, but it's really good for them.
There's other tools that are great for that too, right?
Correct.
But it's just such a versatile tool.
What I do with my injectable practice is I tell all my patients that if I ever bruise you doing your Botox or your whatever your neurotoxin, I will treat it. I will laser the bruise at no charge, because that's just a way that I can set myself apart from other practices that don't have that tool. Right. And by the way, I have had so many patients that switch to me for their injectables, and I say, why did you leave your last injector? And they say, well, they bruised me. And I always put that to bed because I say, well, I might bruise you too.
And again, sometimes it's not the injector is the reason why they got a bruise.
I don't believe, personally, as an injector, I really don't believe it's really ever the injector, because you can have all the bright light you want and all the eventually, how often do we get blood drawn and 15 times there's nothing and then one time there's a hematoma? You just don't know. You just don't know. Yeah. But because I have an Ultra, I tell my patients, well, I'm sorry that happened in the past. If it happens with me, come back as soon as the bruise shows up and I'll take it off, so you don't have to stress over it.
You're telling them it's a possibility, right, and that if it does happen, we've got you, right? Exactly. And I think that's another thing that is a misstep in our space, right? Is like, don't be afraid to tell people what the outcomes are. The drug companies are certainly not afraid of telling you that by taking this you
might die.
Yes, you're going to die, right? By taking this, right? It's one of those things that just get it out there, right? And say, look, there are possible complications, but the one thing is that you've got a skilled practitioner, one, and right, two, if there are any of these things that occur, we're here to help you with that too.
And with complications, anytime you're doing aesthetic elective treatments, it's always a conversation of priorities. Mm-hmm. So what are your priorities? I had a patient just yesterday in my practice who is having her son's getting married in 3 weeks, mm-hmm, and she wanted to do Ultra, and she was concerned about getting what we call mens, mm-hmm, these little brown spots, yep, that can show up, and which is actually good because you're purging pigment, right, that you don't want, but, yeah, she was concerned about it. She also wanted to do some Botox, and she was also concerned about a bruise. And I said to her, well, I think you're going to be fine. I think we have plenty of time, and that if you got a bruise, it could clear. And if you have any mens that show up from the laser, that'll clear in time too. But this is a question of priorities. If you're going to stress out over this and your priority is to make sure that you don't have any complication going into this wedding, don't do it. If you're like, well, there's a little bit of bruise that shows up the day of the wedding, I'll put a little cover up on it, I'd rather have the skin tightness, then do it. And she said to me, you know what, I'm going to wait. And I said, that's fine. That's fine. It makes me feel a lot better, and it also makes her feel better, because you don't ever want to feel like you're at a car salesman and all the stuff's getting pushed on you. It's like, this is you.
I need to bring a car salesman on here so they can defend themselves. Right? Just like you said, math and
right. Yeah, they must take a lot too.
Right? So you have a front row seat to a lot of the innovative things with Cynosure Electronic, and kind of like you mentioned, before to broaden your horizons, you had that's a metaphorical front row seat, but an actual front row seat into attending the things that you're now a part of, right? There may be or maybe not a device that, obviously I'm a device nerd and a laser nerd, but there's one I maybe have a little proclivity to or affinity for, which actually brings in everything that you do, right? What excites you particularly about Accufit, mm-hmm, right? And how you're able to blend that with everything that you do?
Yeah, so that's the one that's kind of the wild card where I feel like I get the most people looking at me and asking, why are you doing this in your practice? Because it's a dental practice.
So can you explain what Accufit actually is?
Yeah, so Accufit is a body contouring device, and it is it's a medical aesthetics device that is using energy to stimulate the actual contractions of your muscles to strengthen your core, glutes, hamstrings, biceps, triceps. Really, most muscles in the body are cleared for use with this device, and it strengthens you. It makes you, we often think about it as an appearance thing. I always like to talk about it more as a functional thing.
Yeah.
But it's what we're all talking about today. It's body contouring.
Right.
And
it's, again, when you look at what you're saying, where we hope medicine goes, right? It's like, it's functional, it's all encompassing, it's taking the blinders off. There, there's absolutely a place for traditional medicine for some things, right? But there's also food as medicine, and what you're doing that can help impact those things. And in your practice, right, with Accufit, you're able to do other things while somebody does that, right? And you're able to, again, you mentioned a very key point with it, where it's not just like you will see, but you also feel your results by 2 weeks after that last treatment. And where, let's face it, if somebody comes in and there's no visible muscle, you're not giving them six-pack abs. And there's a great argument and a legitimate argument to say consistent six-pack abs are made in the kitchen, not necessarily with even just working out alone, right?
Right.
So, but I think that's maybe where this particular device can be less subjective than other body contouring devices, even minimally or non-invasive fat, because there is that feel aspect to it, right?
100%, 100%. Yeah, and it's a very natural fit for me because I've been working in the fitness industry for so long. I have personally experienced it because one of the things that I notice is that after I do my Accufit treatments, and honestly I wish I did more, I have access to this incredible technology, and what I don't have enough of is time. But every time I do Accufit sessions, I notice it when I get on the treadmill. I was a swimmer. I'm not a runner. I don't like running. I never will like running. The runner's high thing that people talk about, I think things in their head. But when I get on the treadmill, if I have done an Accufit treatment in the last week, I feel like I'm somehow lighter, like I'm like flying. I don't even know how to describe it. It's amazing. It makes me actually enjoy running, which is saying something.
Well, we talk about, I know one of the things for me, the first thing that I experienced when I did my original, like my first protocol 4, right?
Yeah.
That and again, there are maintenance treatments that you can do. You don't have to keep doing 4, right? But I'm an ex-athlete that beat up my body when I was younger, right? And we talked about that we travel a lot. And again, I do treat people and demonstrate things, and I'm in compromising positions, and lower back pain on my right side, right? And I noticed that it's not, obviously we're not claiming that it's a cure, but by strengthening my core, my lower back pain subsided, right? And I think that's another great thing, that there are alternative solutions. I mean, what's the one thing that somebody says to you, like a physician will say to somebody when they have lower back pain? Well, you need to strengthen your core, right? How do you strengthen your core when your back hurts?
And is there anyone in the world that has a core that actually is strong enough?
Probably not.
I mean, I feel like no matter how strong it is, it could be stronger.
Right. Unless you're those guys that where they sit there and they do those nails and they lay on top of each other on their cores.
Right.
I mean, there's no downside to strengthening your core, really, right? As long as you can also strengthen complementary areas and you don't overdo one, because if you overdo one, you're potentially creating range of motion issues, right? But again, it also, for that busy person, right, that you're talking about, like yourself, I mean, you utilize it, right?
Sure. Oh, absolutely.
I know you love the arm treatment, right?
I do.
But the busy patient, right, is I think one of the things, and I don't know that it's like statistically the truth, but working with a lot of key opinion leaders and working with some of which would be probably considered the standard in some specialties, right? One of the things since COVID that I've heard regular feedback on is, and the busy practices are busy and they were busy like afterwards, is that maybe they don't see their patient as frequently as they once did throughout the year, but that patient wants to get more done in each visit because they got accustomed to having less time to see people when there was social distancing and everything, right? So when you have the ability to say, hey, while we're doing your face, we can work on your core, I mean, that's almost a no-brainer for that busy person.
A lot of my patients who are numbing for a facial treatment are hooked up to the Accufit at the same time. Because they're captive, they can't go anywhere. I can't use the room for anything else. In fact, we actually even do a slight discount on the treatment if you're not actually taking a room out of you're basically there, and I can't do anything else for you. So let's help you every way we can. I love the machine, and I also think that it's just very we all underestimate how important our core is, and as we I'm fascinated by like evolution, and I talk about evolution a lot with teeth, because, for example, one of my pet peeves as a dentist is people that chew ice. So,
my daughter needs to watch this episode, so I'm going to make sure she does.
Okay, your teeth will break if you chew ice, because we have not evolved. However many hundreds of thousands of years that humans have been on the earth. We are not carnivores. If you actually look at a real carnivore, like a wolf or a dog, their molars are very, very spiky. Like they look like they're canines. That's because they can chew bones. Why do you tell your kids don't give a chicken bone to your pet dog? Why do you?
They're going to crush it.
They're going to crush it, and then the bone spicules are going to get stuck in their guts. So, what would happen if I gave you a chicken bone and I said, chew this? You wouldn't be able to.
Oh, crack a tooth.
Exactly. The bone's not going to break, your teeth are.
Yeah.
And so, and ice is the same way. It's because we have evolved. So if you look at our teeth and you compare us to other mammals that have teeth similar to us, we have teeth like horses and cows. They don't eat meat, right? So we have not evolved for 100,000 years to be breaking bones with our teeth. That's why I have so many patients that come in and I do crowns on them, because they're chewing ice cubes. So what's my connection here? Well, if you talk about mammals, that one of the things that sets us apart from a lot of mammals is that we stand on 2 feet and not on 4. And so that is an entirely different situation for what is expected for our core to be able to hold ourselves up like this for our entire life. And not only are we one of the very few mammals that stands that way, we're now living longer than we ever have. So for 200,000 years, I'm just making this number up, but 200,000 years, you could probably argue that Homo sapiens have been around. Only in the last, that much time are we living 80, 90, 100 years.
If you're living right.
If you're living right.
Yeah.
But that's because, evolution is a slow thing. It's a very, 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 very slow thing. But because of modern science and medicine and technology, we've beat the clock in evolution. In the last 100 years, we've had, a million times of progress that took 200,000 years to get to. And so we have to keep this in mind. When I get older, I want to make sure that I have a core myself, because I feel so bad for these elderly people that are all hunched over, because all of this has wasted. And why would you not, when you're at your dentist or your doctor or any physician, be wanting to take these treatments? It's the same reason we do fluoride treatments on teeth. We're strengthening because we're trying to build for longevity. We're living longer than we ever have, but we have to prepare for that.
Because other things break down.
Right.
And again, everything is connected, right? Like you talk about things with the teeth, it's the same thing with health and wellness, right?
Right.
It's just like if a gear in the clock goes bad, it's going to over time impact other things that are connected to it. Right?
And we only want to live long, fulfilled, longevity, long lives if our body is a body that we want to be inhabiting. I mean, how many people say like, I don't want to live to 100 if I'm going to be, and we can't control everything. You can do everything right and still have things not work out the way that you want to, but that doesn't mean I'm not going to do everything I can to stack the odds as favorably as possible.
It's not that we're control freaks. It's that control the variables you can control, because there's plenty that you can't.
Exactly.
And it's like, Garbage in, garbage out. They talk about that with technology. It's the same thing with our body.
I can't guarantee that you will never get a cavity if you floss every day. But if you don't floss every day, I can guarantee that your chances of getting a cavity are going to be a lot higher.
Greatly increased, right?
Right.
And it's just like the same thing with if you eat lots of processed foods and sugars and everything else. Like you're increasing your chance for heart disease, diabetes, right? It's all the same thought process at the end of the day.
And while my very focused training is on dentistry, I'm still a physician. And so when you're in my office, I'm still one of your doctors, and I want to be able to offer things that are going to improve your life, not just your teeth, because that's where my really focused area of expertise is. But I'm still a physician that cares about you, and I want your life to be better and improved. And that's just, Accufit's just one of the ways that I can bring that to you.
So what would you say your favorite blending of treatments is, or combination of things, like when it comes to like somebody that's like something that's transformative? I have one that I'd like to ask you about.
Sure.
Ultra Skin Solutions.
Yeah.
Right. That way is a combination of RF microneedling with the Ultra that you spoke about. What does a package of Ultra Skin Solution provide somebody?
So that is a dual level of treatment, and the analogy that I give is that radio frequency to stimulate collagen and elastin production is like building the foundation of a house.
Back to your house.
Exactly, yeah. And then the laser on top of it is painting the house. And so depending on where you are in life, your house might be fine with a paint job, but other people, they need a new foundation. And so and in my practice, whenever I do the radio frequency microneedling, I always do the paint job also. So we have these two procedures really married.
So you pretty much try to make sure the patient does both.
Yeah, I mean, so for younger,
if they're going to do RF microneedling,
exactly.
Really
I'm always doing the laser, almost always doing the laser on top of it. But these treatments are, again, these are things that patients don't know is available to them, and I make the joke. From My Big Fat Greek Wedding. Have you seen that movie?
Oh, yeah.
So, Windex, everything,
yes.
So that in medical settings, that's Botox.
Right.
Like people are coming to me, oh, my elbow, can a little Botox here, and like, can you fix this? My ear is a little bit low, can I put some Botox there? I mean, like, people think Botox fixes everything, and it really is quite limited in what it can do. It's an amazing pharmaceutical, and I absolutely love what it's capable of. But in the to the uneducated world, it's Windex.
Right.
Everything gets Botox.
Right, and it's become like Coke or Kleenex, right? It's like the go-to aesthetic thing that people think of, right?
Exactly.
And kudos to their marketing, right? But I'm a big analogy person. That's one thing we're very similar with. Like, I always joke to people too. It's easier for me to remember, right? It's like I'm not smart enough to think about the complex things. If I can if I can bridge the gap, it's exactly. I like the analogy of like fluffing the pillow, right, and because you're providing that volumization and that deeper remodeling, and then washing and ironing the pillowcase.
Exactly. I'm going to use that actually. That's good.
It's very, but again, it's a visual. It's like the Spielberg effect, right?
Yeah.
It's like something that you can see that's away from what you're talking about, so that somebody can actually grasp the concept. Right?
So the Ultra Skin Solution it's just such a profound treatment that people don't know that they need, because they're coming to you and they're talking about their injectables and Botox and filler, and I mean, filler as a whole, we could do a really long talk on that, and I do think they fill a purpose. No pun intended.
Do, but again, to your point, right? Patients not knowing, right?
Exactly.
It's believable. It's refreshing what once was, versus like, even you see a lot of celebrities that are overfilled, right?
Especially the lips,
right? And it's like, look, I'm not saying there's not a place for the filler, right? But let's fluff and iron that.
Everyone comes into me and asks for the same thing. They say, I want it to look like I didn't have anything done. I want it to be subtle. And that's where Ultra Skin Solution is so incredible, because the feedback that I get from almost everyone is when all the healing and it's not a lot of downtime, but when it's all settled and the redness is gone and you're you just had your treatment. People say to me that they went out and all their friends said to them, wow, you look much more rested. What did you do? That's what I always get. Yep. You look more rested.
Yep.
And wouldn't any one of us love to hear that from our friends?
1,000%. And it's one of those things, right? People don't realize that if they've got deep nasolabial folds and deep marionette lines, that's a lot of filler to make that go away. But if we can revitalize and lift and revolumize first, you still may need filler, but less filler.
Yeah, and I'd also like to put a little commercial here that we should not be putting filler into the nasolabial line folds. And the reason for that is that what we're fighting with filler is gravity. And so our face, the way that gravity works on us as we age, it's especially on men, it is a diagonal forward movement. And so, none of us like this space here. And so the instinct to fix it is to just fill this here. But all you're doing is you're adding weight to where the gravity is already pulling. So if your face is being pulled down and forward, and then you go and you add more material here, it's just going to sag more, which is why if you're going to absolutely insist on filler, it needs to be back here, not here.
Well, that's again, people don't realize, I think do more so now, but you can do a nose job with filler, right? Where you change the shape, right? You reinforce, like you're saying, to really kind of anchor what it is your issue is.
Yeah. Right? Yeah, but I would actually still prefer to use microneedling and to treat this, because then you're getting a volumization everywhere. And by the way, the reason that when we pull from back here, I mean, what is this? What am I really? If I'm pushing here, what am I actually really simulating on my face?
Wrinkles.
A facelift.
Yeah.
This is a facelift.
Well, I see wrinkles. Right?
Yeah. Well, yeah, but pushing back here is what a facelift is, right?
Again, like that's the other thing too. Once you cut, you're changing the integrity of that skin.
Exactly.
Too, right. So there's so many more options. Not that there's not, again, there are people that do beautiful faces.
And there is a time and a place for surgery.
But let's do all the modalities, methodologies, treatments, and cutting edge things prior to doing that, because once you cut, you're kind of going to cut again if you want more, right? So, you mentor a lot of dentists as well as other aesthetic people, right? Mm-hmm. What do you tell them, or what would you tell them, anybody who's listening to that, that they could do and that you've learned to expand their practices, right? Like, again, this is a very loaded question because you don't know who the person is that's asking. But what generally, let's say somebody's not doing a whole lot with aesthetics and they're in a particular specialty, like what would you advise them on, and what is it that, again, there's a heavy contingent on what doctors not being happy with managed care telling them how much their time is worth, right? And with medical aesthetics, you're able to, have a little bit more value for your own time in some instances, right? So what would you advise somebody?
Well, let me start with my my dental colleagues, and the one thing that I really need to help dentists understand is I think a lot of dentists underestimate their knowledge and their expertise and their worth. And part of that is society, because we are told, and I can tell you this myself being in the field, even with all of the treatments that I do and all of the, how different I approach dentistry, there's still always in the back of every dentist's head this like, oh, you're not a real doctor, you're a dentist. And there's jokes made about this on sitcoms. I mean, this is very, very like, because even sometimes when people ask me, what do you do? And I say, I'm a doctor. And then they say, well, what kind of doctor? I almost feel this like, I'm a dentist. It's almost like this like letdown, which is insane, because dentistry is actually, it is incredibly competitive to get into dental school. There's so many fewer dental schools than medical schools. The competition to get in is ridiculous. But also the dental admissions tests, and this is something that I really want to remind dentists, there is a section of it called the perceptual ability test, which is literally, and I'm gonna show you some of these questions because we'll put it up.
You've told me about this
Yeah.
before. Yeah, I want to see them.
There are questions where it's ranked. You have to put angles in order, in order from like least to greatest. There's keyhole questions where they give you a three-dimensional image, and then they'll give you like 4 different keyholes, and it'll say which of these holes would this block fit through. And what they're forcing you to do is manipulate images in your head and analyze them and size them up. There is, and by the way, that is one of the single most important skills in medical aesthetics, to be able to look at a patient's face and see geometry and see angles and see proportions and figure out where they're deficient and figure out where it needs modification. There is,
You have to understand exteriorly those things as well as what's going on interior.
yeah, but I'm talking even strictly from the geometric proportion, the spatial reasoning side. There is only one medical provider that is tested on that skill to get into to school, and that's dentists.
So why would they not want to do this then? Because understanding that, right?
Because I think they often forget, and I think they underestimate their worth.
So hopefully this PSA will be
Yeah.
blasted around
Yes.
so that they
Yes.
understand.
Dentists understand facial proportions.
Yes.
Absolutely.
And the geometry of how to fix things, basically.
Right, exactly.
So so that is some of the advice that I give to dentists is just to remember what you trained on to get into school and what your strengths are. And you know, I think anything that's new, there's always a little bit of fear to be one of the first people doing it. I'm an LGBT provider, and so this kind of like taking a stance and saying I'm going to do my own thing is something that the LGBT community is very familiar with, because every single one of us that has chosen to declare who we are has had to basically say, hey, I'm different. And that's kind of why I think I feel more comfortable doing it in dentistry, because it's like, oh, I've got this. I've done this before.
Well, I mean, and think about it. I mean, Apple and Steve Jobs did a whole campaign, Think Different.
Yeah.
Right? I mean, we should be doing a lot more of that.
Exactly. And look how successful they are. I tell people that if you want to end up doing the same thing as everyone else has done, then just, if you
Sign up and punch your card.
Exactly. If you drive down the middle, then you're going to get what everyone else gets. You have to do something different if you expect for something different to happen in the end. And I think I see a lot of that resonates with a lot of dentists when they think about it. As far as every other medical provider, there's really 3 things that make someone successful in this field. The first one is absolutely passion. You have to love it. I have to always correct people when they say, oh, well, you sold out on dentistry. You're doing aesthetics now. I don't think people realize how challenging medical aesthetics is. 100% of your patients are very demanding, because why else are they doing these treatments? It's not like, when you do a filling, no one cares what it looks like.
And it's on the inside.
Right.
A lot of this, if not most of it, is outside.
Exactly.
Right?
So there is no one that's in medical aesthetics because they're looking for the easy thing to do in medicine. I'll put that to bed right now. And the second is you have to be compassionate. You have to really want people to be successful. And the last is you have to be thirsty for education, because the other thing that all of us have in common, I don't care if you are a core provider, or you are a general practitioner, or a nurse practitioner, or a nurse, or a dentist, or whatever you're doing, the one thing that we all have in common is that we, for the most part, didn't learn this in school.
Right.
Your medical school, nursing school, NP school, dental school, it's like your union card. It's getting you into the room where you can do these things, but you still have to learn it. Yep. And so we all have the same basic foundation, but what makes a really good provider is that it's, here I am on the weekend, and I'm, rather than hanging out with my friends, I'm here learning.
Yep. And helping teach.
And helping teach.
Right. And
yeah.
Again, like, in medical school, once most people exposed to medical aesthetics and lasers, it doesn't come until residency or fellowships, right? And they have.
If you're in a core field.
Right. If you're in a core field.
If you're not in a core field, never.
And it never happens.
Right.
And again, like a nurse would have to go to become a laser tech, right? And get certified to do that, right? And so, yes, I mean, in the dermatology plastic surgery world, like for those that don't know, when we reference core, that's what that kind of means, right? Is that in it's it is something, but it's not something that is required for you to become a physician, right? You know, and so I mean, again, we're talking about physics, you know, we're talking about the light spectrum, you know, different frequencies, waveforms, right? And understanding what those do and what adjusting things do and feedback from the skin, right?
And we're constantly learning.
Yeah.
You know, one of my favorite things about being in this field is I've met so many of my colleagues all around the country, and we're always sharing our work. And whenever I post something on one of my social media, the first thing that I get from my friends is, what settings did you use? Because we all want to learn.
And our next guest on the podcast is actually somebody that Dr. James Wang, right? Who is somebody that I know you and I have talked about having those conversations. I mean, you have group text threads now.
Oh yeah.
You know, and you all, and again, this is something that I love that I get to do on a regular basis, is that we, you know, because you all came together and we worked together, now there's those friendships and those bonds that have gotten formed, right? And it forwards our field. It really does.
Yeah, and this company in particular, Cynosure Lutronic, and all of the speakers that work here have been so welcoming. And so Dr. Wang has become a very close friend of mine, and I said to him very early on that you really kind of empowered me to become successful, because you didn't make me feel like an outsider. You know, every dentist or every non-core provider in the medical aesthetics field at some point is going to probably feel a little bit of outsider syndrome.
Like a redheaded stepchild. Like, again, that's probably not a good analogy, but you know, but that, yes, that outsider. I mean, again, it's kind of like you said, that same feeling when you say you're a doctor and a dentist, right? Is like, so like some people, again, that's where they are in life. They're going to frown upon it or poo-poo it or say that you're not good enough, or, you know, which is totally just an opinion, right? Somebody's capacity to learn has nothing to do with, you know, what their chosen field is, so to speak.
Medicine is we say that when you graduate from medical school, you probably have the most book smarts that you'll ever have in your life, but you probably have the least amount of like actual useful information. So that grows for your entire practice. And I guarantee you I couldn't pass my Step 2 dental board right now, the didactic portion anymore, but I know so much more than when I graduated, and that's just from being around people that are always helping and encouraging and lifting me up, and that's what I really have appreciated with all of the friends that I've made here, is all of the support. I know that if I have a question about anything clinical, you know, there's 10 people that I could text right now, and I'd probably have 10 answers in 30 seconds from everyone.
And again, that's what we talk. You asked me, or you talk about like having a good doctor, right? Like, honestly, I work with so many good doctors that, like, even if my daughter has something that I don't know what it is, I'm like, hey, what is this?
Right.
You know, and I'll, like you said, I'll get 5 to 10 responses back from somebody saying, oh, that's this, you should do this, go do that, you know, and it is so great.
Because we're compassionate.
And again, I think that it's one of those things that I've heard from you and I've heard from other peers that some of the best education they got was actually after school.
Oh, 100%.
You know, and you went into a specialized field, right? But at the same time, that thirst to want to be great and to do more and to push envelopes and to truly help people, it does require that additional investment in yourself. Right?
Well, because medicine is always changing. And if you graduated from school 20, 30 years ago, do you want to be practicing medicine that's 20 or 30 years old? How are you going to make sure that as you age through your career, you're still practicing exactly what's being taught in school today? Because it's changing every single year. And that's why I'm very excited to be involved in the community, because it's like you said, how do you keep up? And that's a question that every single provider needs to ask themselves. Yeah. If you graduated from school 40 years ago, do you know exactly what's being taught today, and how are you getting it?
Well, there's so much data out there that is just not good.
Right.
And again, it's if you look at even how the history books have changed, right? As far as like what we were taught in school versus what is now taught in school, it's different. And that was the standard at that time, right?
Right.
More of a fun side note here, right? Again, we back on your topic of being a Renaissance man, you also play instruments and you're fluent in German, right? So
Yeah.
again, with all this investment in education and all these weekends that we do things like this, how do you feel like balance is important, or is balance a misnomer, or how do you find time to enjoy yourself, to have joy? And that's the first part. And then secondarily, how being fluent in German, right? You're also fluent in German. How has that allowed you to help people more?
Well, anytime. So languages are a very big passion. So my other, outside of medicine, my passions are music and language. And by the way, these are all. It's very common that that's all the same part of the brain. It all fits together.
Is it math again, like with the instruments, or there's a creative side of that too, obviously.
I don't even know how to describe it. It's like a formula. And in fact, Loren Mazel, who was for a long time the music director of the New York Philharmonic, and one of the most he's passed away, but one of the most famous conductors in the world, was a mathematician. That was his background. So it's very common that you see these brain types that are just kind of similar.
But having a passion for that direction.
But the ability to communicate and to really reach someone on a deeper level, there's really nothing stronger than showing someone that you know their language. And it doesn't have to be that you speak their language fluently, but I happen to enjoy learning languages. So I'm fluent in German, but I've taken 5-6 years of Spanish. I took a semester of French. I've taken 5 years of Polish. I've taken a semester of Mandarin, just because I'm a nerd and it's fun. But I had a patient.
The world needs more nerds.
I wish. Yeah. I had a patient last month who was a Chinese national, and she came in and there was definitely a language barrier, and I certainly don't speak Mandarin, but I took one semester of it. And she was really nervous because she was in pain, she had a toothache, and she was having trouble understanding. And so there was just a lot of things at play that were making her feel uncomfortable. And I said to her, and I'm not going to say it right now because whoever is listening to this that is a Mandarin speaker, I'm not going to embarrass myself. but I said to her in Mandarin, "I'm an American and I'm your friend." And she just could not believe it. And it right there changed everything, and something that I also want to.
And that's that caring at another level.
Something that I also want to remind people is that as a medical provider, when you meet a patient for the first time, they're walking in the door with an expectation of what they think you're going to be, and you have all of 10 seconds to dispel that, especially if it's a negative expectation, because a lot of people expect to be not treated well by their physician, and the window of opportunity you have to show someone that they are in a safe space before they close the door on that is so incredibly short. And so that's one way that, if I ever suspect that I might know a little bit of the language that is a native to that person, I will always just say something, because it says to them, wow, at some point this person took enough time out of his life to learn a little bit about my culture, and that makes me feel like I'm in a safe place.
I mean, the whole country is a melting pot, right? But at the same time, I mean, there's a lot of different ethnicities and people that are in the DC area where you are.
Yeah.
Right. But again, it's, I think that when you look at just that simple thing you just said, right, it's one of those things that somebody that is just checking boxes is not going to even go there.
Right.
To make sure that lady understood it, even though you said, like you said, it was a basic way of communicating with her. It's just that peace at ease that is gonna that lady is gonna be with you for life now.
And we all need that when we go to the doctor, because no matter who we are, we are always nervous when we go to the doctor. I am a doctor, and my blood pressure goes up when I go to the doctor, and they take my blood pressure. And they're like, "Why is your blood pressure high?" I'm like, "It's because I'm at the doctor."
Yeah.
It's like, because I'm at the doctor.
Yeah.
And so, like, there's no escaping it. This is the human experience of our fears, of our mortality, and having problems with our body. And we need to be always in a supportive and loving environment, whether it's for actual medical treatments or even aesthetics. We need to have that support. That person who's sitting across from you is like, that they are on your team and they want to make your life better.
What's your favorite instrument?
Well, trumpet. I play. That is my instrument.
Yeah.
Yeah.
So what drew you to the trumpet?
I started on alto sax in 5th grade, and the band teacher said, "I think you'd be a good trumpet player."
Are you a fan of the classics, or is, like, as far as trumpet goes, is there any particular song that really kind of resonates with you?
Well, I was a marching band nerd, so I love any, like, Sousa marches or anything
Big
like
bandy type of thing?
not so much big band, but like military band.
Okay.
I always love all of those. I think there's a reason why the United States, the military uses bands in ceremonial settings because it is so majestic, and I just
It evokes emotion.
it does,
Yeah.
and it's a powerful feeling.
Yeah, it is. All right, so one last question. What is a big sort of misconception or something that you see on a regular basis that patients come in with that you could dispel, like right here and now?
In my practice, I'm really here to be Team Paul. Like, I am, every patient who comes in, I'm their biggest cheerleader.
Right.
I want to improve their quality of life. I want them to feel safe. I want them to feel comfortable. I want them to feel confident, and I'm going to bring that to them any way that I can. If it's that you have a dental fear and you haven't been to I have people come in all the time that haven't been to the dentist in 15 years because they're afraid of it, or they don't think they're going to be able to get through it, or that's not going to be the case, because there's no judgment, and you're going to be fine, and we're going to meet you where you are, and we're going to work with you. If it's an aesthetics thing, we're gonna listen to what what your concerns are about your face, and we're gonna propose different ways that we can address them. But we're not going to push anything. It's literally, I work for you. I am your cheerleader, and I want you to be successful. I always make the joke that your face is my business card. So I want you to be confident in your smile. We're never going to do anything that's over the top, because I don't ever want anyone to say, "Oh, where'd you get that bad Botox job?" Everything is going to make you look better, because when you look good, you're going to be happy, and when you're happy, I'm happy. For any business, I don't care if you are a chef, or you're an architect, or you're a doctor. We want our customers to be happy. That's the only thing that makes us fulfilled in our job. If you're successful financially, but you have a business of dissatisfied customers, you're never going to feel contentment or fulfillment.
So where can people find you, Dr. Martin? Where can they find you locally? Where can they find you online to follow what you're doing?
Yeah, so my website is gregorymartindds.com. And my Instagram is Dr. Gregg in DC. I don't have TikTok. I've been told I need to. I feel like there's a lot I'm trying to keep up with. Well, one day I'll have a TikTok. But yeah, I mean, we do a really good job. My staff is really great at
You have fun. Everyone, again, like, that's the biggest thing too. If anybody's in the DC metro area, I just know from being in your office, like, all those things that you said about things you want to dispel, it's also a fun environment, and you have fun in there.
Right. We want people to feel excited to come and get this stuff done. And, our office is in DC, but, you don't have to live in DC. You're welcome to come and visit us. And we have a lot of patients who fly in. One of our biggest dental cases this year was a patient who flew up out of Florida, and he, got some stuff done and stayed in a hotel. We just love seeing everyone, and our practice is continuing to grow, and we're treating more and more people, and it just makes me so happy, because I really do feel like I'm doing what I set out to do in the beginning, which was to disrupt this industry a little bit and kind of give it a new outlook on life and have people feel motivated and safe and excited to get their treatment done.
Gregg, thank you so much for coming on today. I appreciate you as an individual as much as a colleague and as a person. And obviously, for people that are listening in here, he's a tremendous all-around resource with a comprehensive approach that has, like he said, disrupted a stereotype. And again, he's a trendsetter in a lot of ways. And from his ability to incorporate and embrace the digital dentistry to the medical aesthetics and finding ways to take complex things and break them down into simple, bite-sized, digestible, understandable things, that we need more of that in this world. I'm grateful to call him friend as well as colleague. And thank you for joining the podcast today. Make sure to like and subscribe and follow wherever you get your podcasts.